And welcome back to Western New York Living. Now, one thing the pandemic has taught us over the past year and a half is how to use technology. And part of that, the importance of maintaining up-to-date medical records. And my next guest understands this better than most and how to do it with technology. Joining us this morning from HEALTHeLINK, the Executive Director, Dan Parecka. Dan, thanks for being here.
Thanks for having me, Kevin.
Well, for people not familiar with HEALTHeLINK, can you quickly explain your services and how it benefits both patients and doctors?
Sure. So we are the information highway. We aggregate the clinical data from across the community. So when a patient goes from doctor to doctor, their information can travel with them, so the doctors can have the most up-to-date information, the most comprehensive information about the patient, so they can make the best treatment decisions possible.
How do patients get connected on HEALTHeLINK, and do they have to make sure their providers are aware they're part of the network when they're connected?
Well, it's the connection to HEALTHeLINK is the easy part. The doctors are actually sending us the data. It is what the patient has is the key to unlock that data for access throughout the community, and that is the patient consent form that most people have already signed. The good news is most people, in nearly 90% or more of adults in Western New York, have already signed their HEALTHeLINK consent form, which means their doctors, or if they end up, God forbid, in the emergency room, seeing doctors they've never seen before, they can get access to their information and again, make the decisions, the best decision possible.
Yeah, that's one of the great benefits. You know, as you said, God forbid there's an emergency, all the past medical history or medications are there on your HEALTHeLINK account. Along with that, is it safe to say that most medical providers in our area are part of HEALTHeLINK?
Yes. Yeah, 100% of the hospitals in the 8-county region that we service, 8 westernmost counties in New York State, are all participants, and upwards of 75 to 80% of the provider organizations are participants in HEALTHeLINK and exchanging data with us.
And part of that, you know, we talked about the doctors, if you have to go to emergency room, whatever, they have access to it. Do patients have access anytime they want to their own HEALTHeLINK so they can see their history?
That's on the horizon, Kevin. We have not yet implemented the ability for a patient to log in and get access yet, but that is certainly on our roadmap, and we know it's important. I think it's important that they should have access to it, whatever their doctors have access to. It's just one of those things. There's an endless number of things that we can and will be doing over time, and that's one of them.
All right, Dan, it's again important those doctors have all the information. Do want to mention, Dan, since the start of COVID, HEALTHeLINK has been working closely with local and state health departments that help support community response efforts. Can you tell us a bit more about those efforts working with the health departments?
Yeah, so New York State Department of Health, the county health departments, we've been working very collaboratively with both, making data available to them on patients, getting data from them, from the New York State Department of Health centralized repositories that have both the COVID test results and vaccine results. We get that data, and then we can make available to providers, you know, whether one of their high-risk patients has tested positive, or if their high-risk patients haven't been vaccinated. So they might want to do an outreach to them saying, this would be in your best interest. We also provide alerts to providers, to doctors of patients who maybe got the first dose of a vaccine but didn't get their second. So you might want to give them a little nudge. So those are the types of things that we're able to do, and also providing data so that the various dashboards can be created that allow for the tracking and of what's going on.
Yeah, that's certainly very important. Dan, thanks so much for your time. HEALTHeLINK's a collaboration among hospitals, physicians, health plans, and other healthcare providers in Western New York to securely exchange clinical information to improve the quality of health care of patients. To find out more, head to their website at WNYHealthyLink.com. Join the over 1 million people in our area using HEALTHeLINK today. Now, coming up next, one of the hardest parts Debbie had in her weight loss journey was just getting started. We'll find out how the Ideal You Weight Loss Center helped her get to her ideal weight and how they can help you do the same. And after that, we'll show you a better way to a brighter smile, and all can be done in your own home. We'll have all you need to know about Power Swab's teeth whitening when West New York Living continues.
This segment of Western New York Living was sponsored by the following: